Now, in as much as anticoagulants are good drugs and they help us in treating all those blood-related issues where the blood is clotting too much, sometimes they could poison you. Now, state several scenarios where you can get poisoned by an anticoagulant. They also list the examples of what anticoagulants that are most likely to poison you. So this is how blood clots. An anticoagulant, just like the name implies, I'm against coagulation. So anticoagulant poisoning leads to dangerous bleeding because these drugs prevent normal blood clotting. So the drug is all about keeping the blood in fluidity state. Do you understand? But when it's too much, then your blood will be too fluidy. You understand? So the most common causes are, well, don't worry. So what is it? Like, I just wanted to follow it bit by bit. Always the heading of all my, lectures is usually a this thing. What do you call it? A summary. Do you understand? So what is anticoagulant poisoning? It occurs when excess amounts of anticoagulants, those are blood thinners, you take it in. It could be accidentally or it could be intentionally, okay, or through exposure to some rodenticides, okay. So types, the medical anticoagulants, you have things like Warfarin, Heparin, the direct acting oral anticoagulants. We'll get to talk about their classes, don't worry. Then also sometimes rodenticide, also known as super warfarins. Okay, so there are actually drugs that are used in killing rodents, but if you take it, okay, it gives a lot of issue. So causes and risk factors include if you take high doses of those anticoagulants, do you understand, like overdosing on warfarin, or when you are taking anticoagulants with some other drugs, they can interact. So you can interact with antibiotics, interact with what? Antifungals, and some heart medications. So it will now potentiate it. It will now make it act more. So dietary changes. Maybe food that is rich in vitamin K. Then sometimes accidental ingestion of rodenticide. Now it could be common in children. Sometimes you just want to poison yourself and die, but you end up not dying. There's sometimes lack of monitoring, okay, on a patient taking warfarin. So different examples, this is heparin, this is warfarin, So symptoms is, the early symptoms is, you can easily get wounded, you're having nosebleeds, you're having bleeding gums, you're having blood in urine or stool, there's heavy menstrual bleedings. Then when it's getting severe, you are bleeding internally, you are bleeding in the brain. You are losing so much blood, so there's a lot of shock now. You understand? Or prolonged bleeding from minor cuts. So you just cut yourself a little, but you end up bleeding so much. Okay? So you diagnose it from taking history. So you are trying to ask the patient what are the previous drugs they took. Then blood test, then also imaging if there's an bleeding internally. So management include supportive care, hospital administration, then intravenous fluids and blood transfusions. The specific treatment include vitamin K, it's an antidote for it, K1, okay, fresh frozen plasma or prothrombin complex concentrate, then activated charcoal, then long-term therapies, may require long-term weeks of giving the person vitamin K just to, beat it down.